Hello, everyone, and thank you for joining us. My name is Laurel Page, and I am the Assistant Director of Events at the University of Colorado Boulder's Leeds School of Business. Welcome to our 8th webinar series. These continue to be trying times, and here at CU Boulder, we have gathered our world-renowned faculty and alumni to provide frank and timely insights. Today is the final webinar in this webinar series. To view upcoming webinars, please visit colorado.edu/business/alumni, click the drop-down arrow, and click attend online webinars. For today's webinar, we're excited to welcome Nnenia Campbell, here presenting hazards and disasters in the context of COVID-19, implications for marginalized communities. A few housekeeping items before we begin. First, if you have any questions now or during the presentation that you would like to ask Nnenia, please send a question through the Q&A interface. We will monitor questions as they are submitted, and Nnenia will respond to them at the end of the presentation. As a reminder, for optimum audio quality, we do have everyone on mute except for myself and our speaker. If you experience any technical difficulties during the webinar, please notify us through the chat interface and one of our support specialists will touch base. Lastly, a link to access the webinar recording will be sent to all registrants tomorrow, along with a survey link and supplemental resources from today's presentation. Now I am excited to introduce today's speaker. Nnenia Campbell is a research associate with the CU Boulder's Natural Hazards Center and Deputy Director of the Bill Anderson Fund. Her research interests center on the intersects between social vulnerability and resilience, particularly among marginalized communities. With funding from the Alfred P. Sloan Foundation, she leads an initiative at the NHC to develop rapid expert consultations related to COVID-19 and concurrent disasters for the Societal Experts Action Network, which is coordinated by the National Academies of Science, Engineering, and Medicine. Her work with the BAF supports inclusion and leadership among historical underrepresented minorities pursuing doctoral degrees in fields related to hazards and disaster research and practice. Welcome, Nnenia, and thank you so much for being here. I'm going to hand the webinar controls over to you now.
Okay, thank you so much for that introduction, Laurel, and thank you to the Leeds School of Business for inviting me to speak with you today. I truly appreciate those of you in the audience who have made time to log on and participate in this conversation. So I'm so proud to be representing the Natural Hazards Center, which is one of the nation's oldest social science hazards and disaster research centers. And again, it's based right here at the University of Colorado Boulder within the Institute of Behavioral Science. Some of you longtime attendees may recall that Dr. Lori Peak, director of the Natural Hazards Center, kicked off this webinar series almost exactly a year ago with the discussion of the work that the center was doing through its Converge Initiative by funding novel research on the social, behavioral, and economic impacts of COVID-19 and supporting a global network of research working groups in the social sciences and public health. I'm also, again, proud to be representing the William Averitt Anderson Fund, often referred to as the Bill Anderson Fund, where I'm a founding fellow and have recently taken on the role of deputy director. The Bill Anderson Fund works to carry on the work of the preeminent scholar, Dr. William or Bill Averitt Anderson, who had a tremendous influence on the field of hazards and disaster research and mentored many of its most prominent current leaders. And in his honor, the Bill Anderson Fund works to address disparities in disaster impacts and outcomes with an initial focus on supporting historically underrepresented graduate students in the fields of hazards and disasters. And we'll have links for both the Converge Initiative and the Bill Anderson Fund in the chat box. Lastly, before getting into the main presentation, I also want to note that some of the content I'll be discussing today is highlighted in a report that was published in February by the National Academies of Sciences, Engineering, and Medicine. And that report was more broadly focused on emergency evacuation and sheltering during the COVID-19 pandemic, but it features some of the challenges that with conducting emergency operations during the pandemic and provides strategies for addressing them. That report, again, was developed under the Societal Experts Action Network, or SEAN, which was formed in response to the outbreak of COVID-19 last year in recognition of the fact that decision makers at all levels of government have complex questions that are answerable based on evidence from the social, behavioral, and economic sciences. SEAN connects social, behavioral, and economic sciences research with decision makers who need rapid answers. And my work with SEAN is supported by the Alfred P. Sloan Foundation and focuses on the intersections between natural hazards and disasters with the pandemic. There are 4 main areas of focus that I'll be covering today. First, I want to start by talking briefly about the 3 main drivers of disaster vulnerability so that we're on the same page about this concept and what it means to be vulnerable to disasters. I'll then spend the bulk of this conversation focusing on the ways in which one of these drivers, a social element, influences disaster vulnerability, again, across different population groups. I'll then touch on just a few of the myriad ways that COVID-19 has made marginalized communities even more vulnerable to extreme events, and then walk through some recent disasters and the ways in which those issues have played out. So it can be easy to take the notion of disaster vulnerability for granted and think that, okay, we're all vulnerable to disasters, or maybe that there are certain people who are more vulnerable. But when we think about what it means to be a vulnerable person, the label that we apply to these groups do little to help us understand the different dimensions of vulnerability and the ways that different people might be vulnerable in different contexts. So there are several different dimensions of disaster vulnerability, including the hazardousness of different geographies, characteristics of the built environment, and the social environment. And so I'll step through each of those and how they influence each other. So one part of the equation, which seems self-evident, is geographical in nature. So there are certain locations such as floodplains, the wildland-urban interface, places that are prone to winter storms and tornadoes, that are more hazard prone or at risk of different hazards than others. And understanding natural hazards and other hazards in any environment is obviously important to evaluating disaster risk in a given environment. However, one characteristic that human beings share is that we don't simply exist in our environments. We modify them to suit our needs. Natural hazards then also intersect with the built environment, and that plays a role in determining how severe the impacts to populations are for a given event. For example, it doesn't constitute a disaster if a floodplain floods, but there are no structures or farms or other interests located within it. So where we build and how we depend on our built environment is another important driver of vulnerability. So for example, as we saw with the winter storms that struck places like Texas and Oklahoma in February, natural hazards can trigger the loss of the normal functioning in the built environment and in ways that can disrupt critical supports to human and community life. And sometimes failures in the built environment aren't triggered by naturally occurring events, but can also be disruptive, such as when water systems fail and when people are left without basic sanitation and drinking water. But the quality of the built environment is also inextricably linked to the characteristics of our social environment. So social processes influence decisions about where people are located, how well their built environment functions to protect them from environmental hazards, and whether people have the resources they need to prepare, respond to, and recover from the impacts that do occur. There are many different definitions and approaches to understanding social vulnerability within the disaster literature, but for practical purposes and to guide our conversation today, we can understand it as a condition that results from a combination of historical and ongoing societal forces that create a disproportionate potential for loss and negative outcomes resulting from extreme events. So social vulnerability doesn't guarantee poor outcomes, and in fact, many socially vulnerable groups can also be incredibly resilient. Social vulnerability is dynamic rather than static, so it can change over time, and it's also driven, again, by social systems and processes rather than individual characteristics. The disparities that exist under blue sky times or when there's under normal conditions are amplified in times of disaster. So next, I want to touch briefly on the issue of social vulnerability and how it has played out in past disasters. And so today I'm going to discuss what we know about a set of groups that are often understood to be socially vulnerable by discussing things such as age, race and ethnicity, disability status, And in doing so, I want to unpack the concept of vulnerability to kind of steer us toward understanding the social forces at the root of vulnerability, as opposed to characterizing people as, again, somehow innately vulnerable. So some of the indicators that we talk about when we describe populations as being potentially vulnerable to disasters are things like income, race and ethnicity, disability status, gender. All of these things are social determinants. It's about how those identities interact with the social structure, and what it means for those identities to, in terms of access to resources, how they're treated in a population. So it's not a static thing, and the same indicators of vulnerability may or may not apply in a particular situation. So for instance, demographic data published in a 2007 report about who perished in New Orleans as a result of Hurricane Katrina revealed that people over age 65, and particularly those in even higher age cohorts, were significantly overrepresented among the dead. Moreover, it was Black seniors who suffered the highest casualty rates, with the proportion of Black people over 65 being larger than their percentage of the population. And that's a contrast to white seniors in New Orleans, whose representation among deaths was lower than their percentage of the population. Subsequent reports found that even more deaths occurred in the aftermath of the storm in the weeks and months following, and indeed over the years. And there are many reasons for this, including things like neglect by institutions responsible for caring for older people, the location of Black neighborhoods in more flood-prone areas as a result of discriminatory urban planning and segregationist policies, lack of access to transportation, and decisions made by city leaders to prioritize affluent and largely white neighborhoods for power restoration and recovery resources in the aftermath of the storm, to the detriment of lower income and minority neighborhoods, among many other factors. But the key takeaway here is that when we unpack these statistics and look at these deaths and why they occurred, it becomes clear that, again, they're less a function of age or race and more a function of institutional and organizational failures that are driven by historical, political, and socioeconomic factors. Access to pre-evacuation evacuation, pre-disaster preparedness, the distribution of post-disaster recovery resources that enable people to go home or not. Those things diverged along lines of race, class, and also by age. Now, Hurricane Katrina was a catastrophic event that called a lot of attention to the importance of disaster planning and the disparities that can play out in times of disaster. It has been studied extensively by disaster researchers and has become a cultural touch point that many people can immediately recognize. But that can also lead people to believe that it was somehow an exception, especially since now we're more than 15 years have passed since Katrina happened. So before I move on from this section, I want to emphasize that these issues have continued to play out in subsequent and more recent events, such as Hurricane Harvey, which we see here on the screen. Hurricane Harvey struck Texas in 2007, but it started off as a long-lasting tropical storm. And prior to developing into a Category 4 hurricane and making landfall in Texas, Harvey made landfalls in the Barbados and St. Vincent as a tropical depression. And then it made a third landfall over the Yucatan Peninsula as a tropical wave. Most people will be familiar with the impacts that Harvey made in the state of Texas. And it was the strongest hurricane to hit Texas in more than 50 years. It caused $125 billion in damage, and communities are still struggling to recover. There were 68 direct fatalities responsible that were attributed to Hurricane Harvey, and additional indirect fatalities, either as a result of illness, injury, or infection. And although it is estimated that Harvey affected about 13 million people, not everybody was affected the same. Again, the conditions that contribute to social vulnerability place some groups at a higher risk for exposure, leave them less able to prepare, and hinder their ability to recover. And I'll provide a few examples. So as was also the case with Hurricane Katrina, research found that Hurricane Harvey had a disproportionate impact on people with disabilities. While people with disabilities may need additional support in various forms to avoid harm during extreme events, disability itself is not what makes these individuals vulnerable. A person with a disability who has ample access to resources and ample assistance may not suffer any more than significant disaster outcomes than any other person. However, this group is frequently subject to discrimination, stigmatization, and even targeted acts of violence that undermine their well-being and push them into unsafe conditions. And these kinds of social responses to discrimination and social responses to disability contribute to social and economic marginalization among disabled people. It shapes where they live and what kinds of support services are available to them in their communities, both under routine conditions and especially when disasters strike. Disability rates also track along lines of race and ethnicity, class, and gender. So we also see the intersection of experiences and social conditions along those lines. Women have higher rates of disability than men and are at risk of experiencing gender discrimination and gender-based violence in addition to discrimination based on their disability. African American and Hispanic or Latinx people are more likely to become disabled than whites, and also to have to continue with the issues of systemic racism that we've already touched on, in addition to the challenges related to their disability. People living in poverty and in impoverished communities who are or become disabled often struggle with unmet needs, inadequate access to individual and community-based resources, and other challenges related to their economic status. And research has found that Hurricane Harvey-induced flooding was significantly greater in neighborhoods with a higher proportion of disabled residents, even after controlling for other factors such as socioeconomic status. The researchers also found that disabled people with cognitive and ambulatory difficulties are more likely to reside in a neighborhood with a higher proportion of flooded areas compared to people facing other types of difficulties. So these issues are important because we know that people with disabilities are often left out of disaster planning. So they tend to be highly vulnerable to disasters because of their exclusion. And although great strides have been made in the past several decades with respect to legal protections, such as those afforded by the Americans with Disabilities Act, the needs of disabled people often remain unmet, and their capacities and agency frequently go unrecognized. They also continue to experience discrimination in disaster settings. Being overlooked and excluded from disaster planning means that the systems that are developed to respond to disasters are also not well designed to accommodate disabilities, and it opens the door to discriminatory practices. Issues that emerged during Hurricane Harvey also demonstrate how things like immigration status can make people more or less vulnerable. Reports emerged during the storm that immigration enforcement had discouraged households with undocumented people from evacuating to shelters or otherwise seeking assistance from life-threatening situations. And again, this wasn't because people didn't need shelter or wanted to wait out the storm in potentially unsafe conditions. However, conflicting messages and actions from Border Patrol left people uncertain about whether they could trust what they were being told and fueled concerns about shelters and evacuation routes. So next, I want to talk about the impacts of COVID-19 on social vulnerability. And there are three main areas of focus that I'll be covering today with that. And that's financial disruption, service closures and reductions, and transportation disruption. So the secondary impacts of the pandemic tracked along some of the lines that we've already seen with respect to disaster vulnerability. And as with those disasters, the spread of COVID-19 within the United States and across the globe has once again brought pre-existing lines of social stratification into high relief. And although much of the discussion in the early stages of the pandemic referenced the novel coronavirus as a great equalizer, as the country began shutting down, it didn't take long before it became clear that its impacts were not being distributed equally. So most people recognize that the pandemic has taken a significant financial strain nationwide, and the impacts of those disruptions, again, have not been felt equally. Groups that have tended to be economically disadvantaged prior to the pandemic have tended to suffer the worst financial disruption as a result of the pandemic. So for instance, a report that was issued last year by the Robert Wood Johnson Foundation and the Harvard T.H. Chan School of Public Health and NPR found that steep differences emerged in the degree to which the pandemic has produced serious financial disruption across racial groups, with Latinx, Black, and Native American households suffering the most significant impacts. People with certain disabilities have also experienced severe disruption, as they are more likely than non-disabled people to become unemployed and are already economically marginalized, as we've discussed. So these outcomes reflect the socioeconomic drivers of vulnerability that also influence disaster outcomes. And the financial losses like these further reduce the bandwidth of communities to prepare for disasters and to cope with their impacts. So as an example of what we're talking about with the financial strain issue, many of you have probably seen news coverage of the long lines in the past year at food banks. Many states have had to deploy their National Guards to ensure sufficient personnel to keep operations running. And these shortages reveal the severity of challenges that people are facing meeting basic needs. This means that people are also likely to face challenges with things like keeping a 2-week stockpile of supplies for disaster preparedness, as FEMA recommends. And if people need to evacuate, it also means that people are likely to struggle with the cost of evacuation. Now, although this is less frequently discussed within the context of the pandemic, COVID-19 has also disrupted transportation networks in ways that can further exacerbate disaster vulnerability. So the impacts of this haven't been uniform throughout the country, but many transit agencies have reduced staff levels in response to sharp declines in demand since the onset of the pandemic. And those disruptions have been felt unequally because many white-collar workers, such as people who work in tech, who use public transportation, can work from home. It's transit riders working in jobs that still demand a physical presence who suffer the most from these disruptions, and often these are low-income essential workers. And further exacerbating these disparities, COVID-19 has disrupted many paratransit and other mobility services. So service providers have experienced revenue losses, their added costs for personal protective equipment, and in the case of volunteer-based programs, there's been a loss of drivers who are themselves often drawn from vulnerable populations, or populations that are at high risk of the virus, for example, retired older adults. So these issues can amplify disaster vulnerability during the pandemic because socially vulnerable groups already face inadequate access to transportation. That was one of the things that contributed to the outcomes that we saw with Hurricane Katrina. And although many people who lack access to their own vehicles are able to evacuate with peers who do have them, there are social vulnerability hotspots in which few households have reliable transportation. And again, that's an issue that gained visibility after Hurricane Katrina, as many people couldn't evacuate because they lacked access to transportation, and so did others in their social networks that were similarly resource constrained. And social and human service organizations that routinely serve socially vulnerable populations play a vital function as part of the social safety net in normal times. And they're also critical as a component of the disaster response system, whether formally or informally. That's also been touched by COVID-19. So community and faith-based organizations in particular have come under significant strain due to the pandemic as demand has surged, but donations and financial support have become precarious. For instance, in my research, I've found that senior centers that operate programming that keeps older adults active and engaged in social life are experts in older people's needs, and their knowledge and relationships with older community members positions them to be important advocates and translators between the emergency management bureaucracy and older people during emergencies. But these relationships with their clients have been significantly harder to maintain, while older people in particular have been advised to stay home. So although many new approaches have been introduced, such as phone buddy programs and Zoom training, many seniors continue to struggle with isolation. And senior serving organizations are more limited in their ability to maintain those strong relationships with their clients. So I spoke with a representative at my local senior center in the early days of the pandemic who told me that their staff was really struggling to check in on their clients by phone. And this was an extremely time-consuming task, but it was the best way to try to keep tabs on their clients and help with unmet needs. So these kinds of efforts can be even less sustainable in times of disaster when the needs are even greater and the staff themselves may be directly affected. Additionally, other kinds of organizations that are open to the public have closed or gone online or otherwise restricted the accessibility of their services to reduce the risk of virus transmission. And the result of those service disruptions has been reduced access to critical spaces for populations who rely on them. For example, therapy programs like Alcoholics Anonymous have had to modify or cancel gatherings. And closures and restrictions to public spaces have been especially challenging for people experiencing homelessness, as these spaces were where they were able to previously access basic facilities such as bathrooms. And with the closures of spaces such as libraries for long periods, there have been fewer places for people to find important, to access important services and find information. And that further exacerbates their isolation and their disconnection from the broader communities where they live. Services for unhoused populations have also experienced particular strain as traditional shelters have had to close to accommodate social distancing needs, further exacerbating the constraints that are resulting from these closures of other public spaces. And moreover, job losses and other financial strains during the pandemic have begun to push people who are already living on the economic margins closer to homelessness. So next, I want to move into talking about some of the disasters that have occurred during the pandemic and some of the issues that have played out at the intersection of COVID-19 and other natural hazards. So there are three main events that I'll be talking about. The first is Hurricane Laura. The second is the wildfires that have happened in the Western US in 2020. And then the last thing I'll discuss is the winter storms that happened in February of this year. Hurricane Laura started off as a tropical storm that struck Haiti, the Dominican Republic, and Puerto Rico, and causing deaths and damage before crossing over Florida and entering the Gulf of Mexico. So on August 27th of last year, it made landfall as a Category 4 in Louisiana, and Louisiana was already struggling after a horrible COVID outbreak that started early in the pandemic. Laura killed at least 77 people and wiped out significant portions of the housing stock in Louisiana. And this has been devastating for the southern Louisiana region, and it's likely that thousands of people are still suffering. And the numbers aren't well accounted for, in part because the pandemic has created so many administrative slowdowns and strains on systems that respond to disasters. There are several issues that emerged in relation to this event that demonstrate how little time it took for the pressures of the pandemic to weaken our disaster response system and to further endanger people who were already living on the brink. The experiences of the residents at the Golden Arms public housing complex in Lake Charles, Louisiana, demonstrate how the most vulnerable members of our society are being left behind in disasters, and why it's important to have interagency coordination that accounts for people's access and functional needs in emergency planning. I'll go into what happened, the specifics of what happened momentarily. But this example, I also just want to say, also showcases some of the challenges that have arisen as a result of the pandemic. So in this case, a group of low-income minority older adults, many of whom had disabilities, were stranded in the Golden Arms apartment complex for 3 days after Hurricane Laura in dangerous heat and without power or running water as a result of a series of miscommunications and missteps regarding transportation and shelter arrangements. It received relatively little coverage, but the issue that emerged was that buses had been sent to evacuate residents from the facility, but there were miscommunications among where people were being sent and how many people were being picked up. And the second bus that was intended to go back and pick up the second half of the apartment complex didn't arrive. So people were stranded in sweltering heat without, again, access to running water and running out of food. And so, although residents called many authorities for help, there was another National Guard unit across the street. They had a hard time getting people to respond to them. So during these 3 days, people weren't sitting there passively, but everyone that they spoke to said that it wasn't in their jurisdiction, that somebody else should arrive. An ambulance, medical personnel arrived at one point, looked people over, said that they weren't in immediate danger of death, and left. And so ultimately, these residents were rescued when an organization called Crowdsource Rescue that was formed during Hurricane Harvey was flagged down by somebody who lived in the complex and got them and another volunteer organization to take people to other evacuation sites. They had been left there. And so we can learn some valuable lessons from this example about considerations for the kinds of issues that are likely to emerge during the pandemic. Some of these folks may have had other places where they could go, but the advice for social distancing was to look for to follow the social distancing guidelines, and people were told that they were going to be picked up, taken to a non-congregate shelter, one of the many hotel rooms that the state of Louisiana had set aside for people so that they could safely evacuate. And those failures of communication potentially led people to miss out on other opportunities to find different forms of protective action, take different forms of protective action if those were available to them. So again, we need to start considering how public housing facilities and other social vulnerability hotspots and disaster planning, including in outreach by emergency managers, need to be included. They need to identify points of contact for information, for obtaining assistance with evacuation. And there clearly needs to be some kind of intra and inter-organizational emergency response activities in disaster plans to provide clear directives on how representatives of various organizations should respond when they encounter people who need help in ways that may fall outside of their mission or their jurisdiction. There needs to be an emphasis on life safety to ensure that systems are in place so that people can have some recourse when they face situations that are dangerous but deemed to be not immediately life-threatening. Also in Hurricane Laura, we saw that nursing homes and long-term care facilities, which were already struggling to limit residents' exposure to the virus, experienced compound threats during Hurricane Laura. For instance, these facilities had to weigh the risk of relocation trauma, which is a severe form of psychological distress that can be brought on by rapid relocation, with potentially fatal consequences if people were left in their locations. And so people had to consider, organizations had to consider how this is compounded by the risk of virus transmission that could occur in the process of transporting or sheltering residents. So this meant that some nursing homes and long-term care facilities were reluctant to evacuate because of the concerns of relocation trauma, and that those that did also struggled under the burden of new coronavirus protocols. So the costs associated with evacuation were also higher, as facilities needed twice as many buses, ambulances, and other vehicles to move residents to enable social distancing and to ensure that COVID-19 patients weren't being transported along with other people. And all these modifications meant that the evacuation process took a lot longer and was far more resource intensive than it is during a normal disaster outside of a pandemic. And ultimately, the evacuation process was also more stressful. So in some instances, facilities failed to notify families where residents were located or to inform residents when they would be able to return home, further exacerbating the stress and trauma of their evacuation. And additionally, research has found that rates of COVID-19 infection are likely to increase in both the origin and destination locations when evacuations occur. And so again, that highlights the potential for that elevated risk throughout relocation and upon return. Next, I want to touch on the Western wildfires. So many of you may recall that parts of the Western United States saw some of the largest and most expensive wildfires on record over the past few years. And the 2020 wildfire season made those things even more challenging because of COVID-19. The fires were particularly severe last year in Oregon, where at one point 10% of the state was under evacuation orders. So this meant that evacuation sites were overwhelmed as demand for hotel rooms and other spaces where people could socially distance soared. Respiratory problems were a particular concern, as N95 masks were generally unavailable to people who didn't already have them because the supplies were being directed towards healthcare providers. And air quality was affected throughout the Western states, and many people remember going out and looking at the sun and seeing that you couldn't really see the sky, or that the whole sky looked red or orange. And so this was particularly dangerous for certain populations, such as unhoused people, because the groups that would normally do outreach to provide masks and shelter had limited supplies. So as I mentioned earlier, even before the wildfires, unhoused people were unable to access alternative shelters because the shelters were being affected by the pandemic and having to move operations. Some shelters were opened for non-congregate sheltering environments, but this diminished the number of resources available. And there were many people who weren't able to access those shelter arrangements. There was also that reduction of public spaces because of businesses being closed and other public spaces not being accessible. So there was this dwindling of resources, and then the wildfires added another layer of intensity to that situation. So again, smoke exposure amplified the health threat that unhoused people faced. And yet many communities had no programs available to administer PPE to people who were living outside, despite the risk of of smoke exposure being a well-known issue. And even in areas where there were government or community programs for things like mask distribution, where masks were provided, these, again, were not N95 masks. These weren't masks that were rated to filter out smoke, and supplies were limited. So in addition to those kinds of issues, in some areas where there were evacuations that were called for, such as in the LNU Lightning Complex fire in California, many people experiencing homelessness were left behind. There weren't plans to include them, and they had difficulties accessing information. So we see time and time again how unhoused people are left behind during disasters, and especially with the closures of spaces where they can normally seek refuge and information, these impacts are compounded. And the last example I'll provide is that there were two back-to-back winter storms, unofficially named Uri and Viola, and those landed across states and across the U.S. South in February of this year. And the storms affected southern states that are typically unaccustomed to cold temperatures or snow or ice. And that's important because the infrastructure wasn't built to handle the impacts that they felt. So those storms affected places where the built environment was poorly equipped and not insulated to handle major freezes. And the consequences of this were devastating. The storms caused deaths and in terms of vehicular accidents and other kinds of deaths across a multi-state area. And there were also 12 deaths in Mexico. The storms were experienced by at least 100 million people. But again, as we've seen in all of these disasters, the impacts were not felt equally. So many of you likely saw the coverage of the storms in the state of Texas, which plunged millions of people into cold and darkness due to major power outages and left people with outrageous heating bills. So to briefly cover that issue, unlike the rest of the continental US, the power grid in Texas is not connected to the federal energy system, and it's instead operated independently. The storms led to prices in the wholesale market for electricity to rise as thousands of dollars per megawatt by thousands of dollars per megawatt, whereas they normally fall within the $30 range. And so this wasn't immediately passed on to most consumers where prices are locked in on contracts, but many people had variable contracts where the electricity for their electricity, and as a result, they saw their bills skyrocket into the thousands of dollars. The storms also highlight some of the challenges that were created by the pandemic and how those have been exacerbated by extreme events. So here too, we saw that people who were already hardest hit by the pandemic were among the most severely affected, with few resources being made available to help people who were stuck inside their freezing homes initially without power or electricity, and where there was little access to transportation assistance. So people who didn't already have access to a private vehicle struggled to leave their houses when they ran out of power. And so this meant that even when people had other options for warm shelter, there was no way for them to get there. People with disabilities who depended on electricity were also left to fend for themselves in many cases, despite the fact that the state maintains a registry that can be used during emergencies by emergency managers to reach out to the people who need it most. So people who relied on assistive technologies and equipment were particularly hard hit. And initially it was difficult to find information about what services were available. And then when people were in a position to leave, folks with medical vulnerabilities were stuck with the impossible decision between trying to seek warmth and shelter and potentially being exposed to the virus. Again, something we saw in the other examples, like with other evacuations. So there weren't resources to facilitate some of those decisions. And people experiencing homelessness had difficulties finding shelter, again, due to the closures of of buildings and public spaces where they might normally try to seek temporary relief from extreme conditions. There's also the issue of things like sweeps of homeless encampments. That's a practice that the CDC has advised should stop because it can increase the risk of coronavirus transmission. And it also, another effect is that it further reduces the resources that people have to deal with extreme cold, because those who aren't there at the time of the sweep often lose their belongings. And so indeed, we saw that at least 6 people who were unhoused died during the winter storm in Texas. It's also hard for unhoused people to access information in this situation again. So although advocates drove through the cities trying to find people and bring them to warming centers and shelters that were set up, they were at the mercy of hearing from others or being found at the right place and at the right time. So in wrapping up, I know I've hit you with a lot of information, and I want to leave you with a few brief insights about how these incredibly daunting issues can be addressed. First, I can't emphasize enough how important it is to pay attention to the drivers of social vulnerability, things like power dynamics that influence different systems of oppression, privilege, and influence that can either increase or reduce a group's exposure to disasters and the outcomes that result from it. So we have to really understand the social drivers of vulnerability if we're going to be able to target resources to areas where it's needed and in the ways that it's needed. Also, we have to recognize that the pandemic has created new challenges, but it's also unfolded along familiar lines and in communities that are known to struggle because of the barriers that they are already facing. So we have to recognize that COVID has amplified the pressures that many groups already faced. And that means that people who work with these communities, and particularly those who provide disaster services, can respond to the different ways that people are vulnerable and to recognize the different ways that vulnerabilities can accumulate. That's vital because it can be easy to lump people together who are facing vastly different challenges. So the point isn't to have a separate plan for every person's identity, but to take a more inclusive approach in talking to them about the struggles that they're facing. And we've seen that the challenges that many groups face, though not identical, often stem from similar root causes. So approaching disaster response from a place of inclusion means finding ways to be more holistic and accommodating by default. And this can unlock new ways of approaching problems and supporting people with different needs. And finally, the challenges that different groups face can't be solved through top-down approaches that make decisions on people's behalf and without their involvement. There's far less of a learning curve when we find natural networks and local leaders within communities to tap into the strengths that already exist and engage them as partners. Too often, our disaster response system and the ways that we think about people who are vulnerable to disasters are paternalistic in nature. We think that we know what's best for people, and we don't talk to people about what their needs are and what their strengths are and what it is that's making them vulnerable. And so connecting with the work that's already being done, again, helps to leverage the strengths that are already there and respect the agency that people have. So with that, I want to wrap up, and I look forward to the Q&A, and just submit your questions using the Q&A box.
Thank you, Nnenia. And yes, as Nnenia said, please submit your questions using the Q&A box. Our first question is, how has the coronavirus affected people with disabilities? What improvements can be made?
Well, certainly we see that there have been financial impacts for people with disabilities as workplace, and in both ways. In some cases, the switch to remote work has been beneficial in that it has opened up new areas of access and accommodation that weren't being pursued, even though they existed prior to the disaster or prior to the pandemic. But what we've also seen is that many people with disabilities have been among the first to lose their employment. That many many disabilities make people more vulnerable to contracting COVID-19. And so there have been challenges with that as well, on top of the other challenges that we've seen that have unfolded in disasters. And so the effects on people with disabilities have been significant, and they stem from lack of prioritization. Things like the variability in programs and state guidance on when people can be vaccinated have not always worked in the favor of people with disabilities. And so we see a variety of different ways, but overall an increase in pressures on many people with disabilities, particularly those who have limited resources. Again, it's not about the disability itself, it's about the way that society supports people with disabilities or not.
Thank you. Our next question is, how soon can we expect communities to recover after the COVID-19 disaster, now that the vaccine is being distributed to all?
I think it can, that's an open question. I don't think that we can answer that question at this point, because there's a lot of, we're not there yet with the vaccines, and we don't know how it's going to play out. But with disasters, we do know that they can take a very long time, and that particularly for people who aren't able to bounce back, who don't have the resources to bounce back quickly, it takes longer. There are people who've never recovered from Hurricane Katrina, for example, and in some disasters, it can take 10 years for a community to start bouncing back. And for communities like Lake Charles, where the Golden Arms apartment complex was located, it can be a long time. There are many, many people in Lake Charles right now who are still unhoused, and homelessness is on the rise nationwide, and particularly in Louisiana. And many of the people who have lost access to resources were struggling during the pandemic and then were wiped out by Hurricane Laura and subsequent storms. So I think it's really variable. I think it's going to depend on the resources that we allocate to recovery and how much support people have to recover.
Thank you. Our next question comes from Olga. Are key partner government agencies working to talk directly with vulnerable populations? The US Census did significant outreach to count the traditional undercounted, so they might be an obvious partner. It
varies. There are many emergency managers who are aware of vulnerabilities within their populations, who work with community representatives and gatekeepers, but that's not always the case, as we saw with some of the populations that we spoke about today. And there are ways to reach out to communities, and particularly by involving organizations that represent the communities who are experiencing negative impacts and disasters. So local community and faith-based organizations, like I talked about with senior centers, can play a key role in working with those populations. But it varies, and often those organizations that can provide not just information about how people are struggling, but also expertise that can inform planning and help to head off some of the negative impacts that we see. It's really vital to build those connections, and that's not always done, even in areas where people know that they should do it. Like I spoke about in Texas, where there's a registry, where there's been much conversation with emergency managers at the state level, but there's still a lot of shortcomings in the system.
Thank you. Our next question is, how can I help improve these communities' vulnerability?
Well, there are a few different ways. Certainly thinking about how you interact with these communities in your own work or in your own life. There are opportunities to volunteer. For example, the Disaster Justice Network is an organization in Southern Louisiana that's trying to address some of the ongoing impacts that are still very dire in Southern Louisiana after Hurricane Laura. The Bill Anderson Fund, of course, as I mentioned, is an organization that tries to that supports graduate students studying hazards and disasters, but you can also do more direct things like volunteering with organizations that are doing work with these communities. For example, my colleague, Jamie Vickery, who also is a PhD from CU studying disasters, she did her dissertation research on the 2013 floods following Colorado. And as part of learning about what her dissertation focused on, the issue of homelessness and how people who were unhoused fared during and after the floods. And as part of doing that research and learning about those issues, she volunteered and has maintained a relationship with the organizations that serve unhoused populations. And so I think directly working with those organizations, but also, again, remembering that it's a support role that we need to be playing, that it's not about parading in and telling people what they need, but really listening to and working with them and helping to empower that to happen.
Thank you so much to everyone for joining us for today's presentation, and a big thank you again to Nnenia for this great information. At this time, we invite you to provide your feedback on the webinar by answering the following poll question. On a scale from 1 to 10, how likely are you to recommend this webinar to a friend or other CU Boulder alumni? We thank you in advance for submitting your feedback. As a reminder, all webinar attendees will receive an email tomorrow with a link to the recording of this presentation as well as a survey. To view upcoming webinars as well as previous recordings, please visit our website at www.colorado.edu/business/alumni. In the meantime, have a great rest of your day. Thank you for your time, and go Buffs.